Yep. And then the next question, this is also from our S2 members, is menstrual cycle, how does it impact, like, kind of exercise performance, and why do they feel so fatigued, stressed out, and then these headaches before the menstrual cycles or during, how they can handle them?
Um, this is a good question that I'm experiencing now. So I'd say it's perimenopausal time where people are in their 30s and 40s, where their natural reproductive cycle is gone and they're going into perimenopause or premenopause. Um, in endocrinology or OBGYN world, there are two conditions where they say there's premenstrual disorder and premenstrual dysphoric disorder when it's more severe. They did study like 900 people. They did study over 900 females about what symptoms they have or how is it affecting their life. It's mostly in the luteal phase where it's like a second half of your cycle that you have these symptoms. And they came up with a list of almost 200 symptoms. Can you believe it?
Wow.
Most of them are like you're feeling tired, you feel guilty, your mood's not good, you're very irritable, you have headaches, you low sexual drive, things like that. um, and they tie this to the luteal phase where your progesterone is high. There are physical, behavioral, and also the I mean mood disorders which are more severe, where it's depression and
Mm,
clinically diagnose those. So if it's more in the less severe form, then you can, things that help that they found on the study was exercise. So that
mm,
again is regulating hormones
mm,
in various ways, not just one. And there are medications that like there are herbal supplements and things like that, but we are into allopathy, so I cannot make suggestions of what you would need. But they do say that just if you have a consistent good lifestyle, I think it helps in that last luteal phase too. So I'd
mm.
say consistently having exercise routines or mindfulness routines, or um, just doesn't have to be in those 10 days, it has to be all the time,
Okay.
then it just
Okay.
helps you. So
Okay. Okay. And anything particular, like, for those headaches, because a lot of people, like, women especially have migraines, and then we suggest them to go to a doctor because these are migraines clearly, and then they don't want to be on preventive medication. Because I myself, I've been on preventive medication for the past 10 years. But I see a lot of people are reluctant to go on preventive medication, and then they lose the quality of life.
again, like I said, it's because of the changes in progesterone levels in that time.
Yeah.
But
Yeah.
there are ways to not have those fluctuations that do happen,
Yeah.
like regular oral contraceptive pills, or
Yeah.
which just, I mean, when you're going into menopause or perimenopause, it's hard to predict. I mean, this is
Right.
an area of science where they're still doing a lot of studies. There are
Mm-hmm.
some medications that came out to help. I mean, trialing, anything you take is not permanent. You can always stop it if it's not
True.
helping. So
Yes.
I tell my patients to have a mindset that you take a pill and it helps you and it's not giving you any side effects and making you more productive. Why not, you know?
Right. Right. Got it. Yep. So that's one of the good questions we had. And then, while we were touching on the women's health, I also wanted to kind of touch base on, men's health, because I feel that men neglect their health a lot. We see so much obesity, especially truncal obesity, in men a lot, and then the eating habits are like so bad, how it would affect men's health.
I mean, similar to although women have like monthly fluctuations, men's health, I would say definitely. When you're younger, you're doing everything, as per your lifestyle is different. Your body still can reverse some of that. But as you're aging, you're also losing the production of testosterone. And when you have alcohol or a different, like not as great lifestyle or truncal obesity, all those reduce testosterone levels and they do affect serum, like infertility and all that does come up a lot. I mean, we see, so, from the time I did my fellowship, I used to see patients in 40s and 50s and 60s who come for testosterone replacement. Now I see people in 20s, 30s
Mm.
coming for testosterone replacement, which is going to be like probably 50 years of their life or 60 years of their life.
Mm.
We always suggest lifestyle, but it's like a chicken and egg pattern. They don't have energy, they can go work out, they want something, quick fix.
Right, right.
So it's, and then whatever we give you suppresses their own testosterone. So it's,
They
there's
get the
not an
bad.
easy answer.
Yeah,
So cleaning up lifestyle is like a basic, first thing that we say. I
got it.
mean, and probably 80% of patients that come to me um, have already heard that, but
Yeah,
they are not given steps or they're not given real practical solutions on how to act that.
yeah, yeah.
Yeah, so I think that's where people like you are coming down to basics of
Right, right.
breaking those myths of
Exactly,
you know,
because I see so many men having concerns about, like, all the wrong things, right? They think, eating soy is going to make them, like, kind of, make their hormones all over the place. But then, I see them eating so much carbohydrate, so much unhealthy fats, and then in my
yeah.
mind, I think, it's not the soy products, it's the other stuff, and then you being
I'm also
sedentary is a
I'm
problem.
also against this myth about one food is bad for you, one food is good for you.
Yeah.
Food, you eat food for a reason, so everything has its good and bad, depends on the time of the day you're eating it, the
Yeah,
portion, and how often, or anything can be dangerous if you eat too much of it. So
exactly. Yeah, exactly. Yeah, that is so true. Yep. So, and then the other question basically, like, which constantly comes up is your input on the intermittent fasting.
okay, I suggest that to all my patients,
Mm.
but you have to trial and error basis know what is good for you.
Yeah,
Listen to your body. Sometimes, I mean, eating your early dinner is always
yeah,
helpful. And when you do that, you start with, I tell them to start with like a 12 hour,
yeah,
which is more like you're in your sleep, you eat your dinner by 7, then by the time it's morning it's already 12 hours for you.
yeah.
Then I ask them to push it like each hour and see how much you can do.
Mm.
But longer is not better. Some people have a lot of hunger by the time they're done with like 13 or 14 hours.
Mm.
Then they're eating all wrong food.
Mm. Yeah,
So you have to kind of pay attention to what your body is telling. Maybe by 13th hour you're really hungry, then that's your point.
yeah,
Again, any intermittent fasting or any diet is as good as your consistency.
yeah,
If you're consistently able to do 12-hour fasting, that's your thing, and that'll give
yeah.
you result. And
Yeah.
I know there's like 16 is to 8, 14 is to 10, all those things. And I
Yeah.
have patients who do 36-hour fasts. I tell them, don't get hospitalized. If
Yeah.
you're able to do it once in a while, that's okay. But yeah, I'm never listen to your body. Like that's
Yeah. And also I have like some members like who try intermittent fasting, and then what they in their mindset what they think is when they fast for those 12 or like 14 hours, for the rest of the time they can eat whatever they
yeah,
want to. What do you think about that?
yeah. Like I said, it's not a free pass to eat whatever you want.
Yes,
Yeah.
yeah,
So
yeah. Because in the like the first question was like whatever you eat is going to release the insulin, and then insulin is in short weight gaining hormone,
yeah,
and then it doesn't think about your rest of the fasting hours.
yeah. I mean, if you're think about it, you're not having any insulin spikes or glucose spikes for 12 hours, but all of a sudden you have a Mount Everest peak.
Yeah,
That kind of negates the fact that you just fasted for.
right, right.
So um I mean, your body is in like a starvation mode by then, it's breaking
Yeah,
fat.
yeah,
But if you give it like 100% glucose for some reason, then it's not doing what it's supposed to do. So
right.
still mindful eating is important in those non-fasting hours.
Yeah, yeah, exactly. And then basically, like, if you kind of abuse your body like this, like where you starve and where you eat high sugary food, very rarely, like, kind of some people will get this, like, kind of reactive hypoglycemia, like rare kind of, like, issues also.
Oh yeah, I see that a lot.
Yeah,
We are seeing that a lot with younger patients.
right,
Not sure if it's the processed food that we have, or
right.
out of the blue, they never had any pathology. They just have
Yeah,
these episodes of low blood sugar that are happening because you increase your sensitivity to just processing sugar, and
yeah.
sudden you eat sugar, then you can't tolerate it.
Yeah, yeah. And then your blood sugars drop, and then the next thing comes to their mind is like eating something sugary again, and
Yeah,
then it's just like a vicious cycle. Yeah.
yeah,
And
that's
now
right.
you like, that you mentioned like processed food. Can you just like, kind of briefly talk about processed and bioengineered foods also?
Yeah, we see this label called GMO and non-GMO foods, genetically modified organisms.
Yeah,
This is more a way to make food last longer with certain ingredients being in there. Is it good for you? There are not enough studies to say that it's completely safe. So if you're feeding kids or you're worried about their development, if you have a choice between non-GMO or organic or farm fed, I would definitely go towards that. And if a GMO containing food is the only thing that you have, and you have to eat it, that's okay. Again, that's why we say anything is not very good or very bad food.
right.
When
Yeah.
you eat, even if you're eating a GMO containing food, then you have to really say where the quantity you're eating or the portions, or
Right, right. Yeah, like you said, basically, like, these genetically modified foods, like, because they have not have enough studies, we always prefer, like, regular, like, kind of
yeah,
fresh
if there is a
food.
choice,
If there's
definitely
a choice,
non-GMO.
if there, yeah, of course, if there's no choice, it's fine. And especially, like, for the kids who have, like, who are prone to allergies, we don't know how they will react, to these foods because these are like modified foods.
Yeah,
Yeah, so that's one. And then like, kind of, we are almost towards the end. One thing is the processed foods, and then the dietary habits, and then the precocious puberty we have been seeing in both females and males these days. We can throw some light into that.
yeah. I mean, it's a real problem. And try and stick to foods which are more natural, or what goes into making them, or what goes into, even if you're eating something like a dessert, if you make it, you know exactly what's in there, versus
Um,
There's patients ask me if is it good to drink like a V8 vegetable juice, and I'm like, it has all
When it's in a
vegetables in
carton.
it, or it has all fruits in it. That means it's been there for a while. So whatever is making it last that much long is not what's good for you. So
Right.
so processed or preservatives, it does take much time, but this is what you respect your body with: fresh food as much as you can, fresh
Yeah.
ingredients as much as you can. I know they've become expensive, but this is also one thing that I come across a lot, that they say fresh food is expensive now, which is
Yeah.
correct. But they tell me I bring a ball of salad and after a week I'm throwing it away. So I said, just you spend 10 minutes planning your meals. You just make smaller meals with that ball of salad, make use of the money that you spent. Just smarter ways to stay to
Yeah.
stick
And
with.
yeah, that is so true. And then also, I kind of like, keep telling, my patients or like, as to clients, when you cook a like, kind of fresh meal, freeze it. You can freeze that. Like
Yeah.
that's best compared to, thinking that, it's going to go spoiled or like, just like freeze it and then
Yeah.
you can use it for the rest of the
There's
week.
also a myth that frozen foods are, not very good, but it's better to have your own cooked leftovers than to have something fresh from outside.
Yes, yeah. And then, frozen foods are like, much better than like, eating something which is like
Yeah.
purely unhealthy because most of the, kind nutrients are like much well preserved in frozen foods. And I think almost the last question, we wanted to touch base on. There is this like a lot of new medications coming in. We have a lot of experience with all these medications, the SGLT2 inhibitors, Monjaro and Ozempic and all that. Just you can talk briefly about these medications before we wrap up.
um Again, that's our practice. Like, majority of the practices, you're prescribing these medications. Again, as I told at the start of our talk, we just, prevention is better than going on a medicine. And I tell them this is just a crutch to get you where you want to be. Um, Again, we cleaning up lifestyle and then taking the help of these medications. All the studies have suggested that SGLT2 inhibitors and GLP-1s do GLP-1 agonists do have a lot of cardiovascular and renal benefits, and they are being approved for more and more non-alcoholic fatty liver disease, possibly for Alzheimer's. So we are going to see these medications more than for just obesity or diabetes. So I consider them as friends. I mean, you do what you can. Lifestyle is not an alternative to being on medicines, or medicine is not that you could just live your lifestyle like anything and then
Yeah,
take the medicine. So they have to be in combination, and they are life changing results for a lot of patients who are on these medications. So they do work.
yeah. And then, one concern, like, I hear like, from basically family and friends, is the like side effects from this medicine. Is you've used a lot of these medicines, and then, as a kidney doctors, like, I also see a lot of the patients also. Um, I mean, my patients are doing fine actually. So you can throw like,
I
kind of, yeah.
tell them that it's better to have known evils than unknown evils. You know what to expect. We always go over the side effects of what you should see, like urinary tract infections, or yeast infections with SGLT, or constipation, um,
Yeah,
or GI stomach upset, or other things with a GLP-1 agonist. So we're warning about them. That's our job when we're prescribing them, to say, okay, these are the side effects, this is how you prevent it. uh,
yeah,
and you see us every few months for a reason, and this is what we are monitoring. So it's safe to take them. Again, our first goal is always to avoid taking them, but if you need it, don't be I mean, science has developed to say that you only need it for 3 months, 6 months. It's not lifelong. I think that's the notion that people have, that okay, once put on medicine, you'll always be on medicine. No, that's not how it works. You can always come off of it. Our goal is always to come off of it, and then um, continue to maintain weight loss or not get
Right.
back, things like that. So
Right. Right. Well, I think this was like a very informative like session, Dr. Sudha. Is there anything else you want to tell our like audience before we wrap up?
most of my patients, it's the mindset.
Yeah.
Don't ever think that changing what you're doing for years is hard. You can always change anything you want.
Yeah.
So you really should have that intention to change.
Yes. Yeah.
And I always say small changes, aim for small changes, then you'll stick to them.
Yeah. Absolutely. Well, we always say that basically, like, it's never too late to start, and then consistency will get you somewhere, not only about your weight or health, for anything in life, be consistent. And we're always here as your doctor friends. And thank you so much for coming on the show and say yes to healthy life. Thank you.
My pleasure. Bye.